MOE has invited NTU to submit a proposal to start a new medical school in Singapore. NTU had done their homework and had decided that the medical school really needed a clinical partner, and hence they came to Tan Tock Seng first. And Tan Tock Seng, knowing that it cannot be just a hospital effort, it became a cluster effort. The approach that we took was that we will be equal partners in the development of the medical school. We sat together and discussed and articulated clearly what is this medical school going to stand for. PPEO was set up in 2013, and prior to that, medical students were under the purview of the Associate Dean's Office. Nursing students tend to be under Nursing Service, and allied health professional students tend to be under HR. So there is no overarching structure. Every office and unit is left to design its own orientation, to set up its own house rules about do's and don'ts. By 2013, NHG Residency Office had been set up for 3 almost to 4 years. That was very fortunate because the journey for PPO at the starting point at least became much less painful. The 2013 PECT is a landmark, and I'm very grateful because with the resources provided to us now, we are truly able to value add to students' learning, to the teaching by our clinical teachers and faculty, as well as the professionalization and the work that our administrative colleagues do. This was a great move because it provided the resources needed for a proper office to take care of all the students who come through the institutions every year to undergo clinical placements in the institutions. COVID-19 has actually brought on a new phase, and that is how NHG has helped LKCMedicine to weather the disaster or the COVID-19 outbreak. When all the students were sent home on the 7th of February, when Ministry of Health declared DORSCON orange, the clinical years, year 3, 4 and 5 were the most affected. And the clinicians had to step in a very big way to create a substantial amount of new content and new ways of teaching in order to make sure that the clinical years students in terms of learning are disrupted as minimally as possible. I'm really very glad that it came to pass during my career as a clinician educator that the PPEO could be set up.